Herb. Herb is a plant. I mean, herbs are good for everything. Herb.
Hello, you made this trip to the Eugene Cannabis TV show, and we got some news for you. We're still talking about the raids going on in Southern Oregon. If you haven't heard, the DEA, and this time it is a DEA, not a generic term for narcotics agents. This is actually the Drug Enforcement Agency, feds, are in Southern Oregon, and they've conducted, I believe it's their fourth or fifth, at least fourth, raid, confiscating legal medical marijuana grows, legal statewide, and it's quite disgusting, and so we've got a couple more stories talking about that. This one here, they had a protest that I would have liked to have gone to, but I couldn't make it. It was last Wednesday. It says in Medford, dozens of medical marijuana protesters took to downtown Medford demanding their medicine back. Southern Oregon NORML organized a rally after recent raids in the area. Protesters paraded down streets and even stopped in front of federal buildings. Organizers say they want federal agents to respect Oregon law. We're not going away. We live here and pay taxes and vote. We deserve respect for our medicine, Southern Oregon NORML Director Lori Duckworth said. Growers and patients urged federal leaders to stop raiding gardens they believe are legal. I didn't do anything wrong, protester James Anderson said. Anderson's garden was raided a couple weeks ago and he is out of a job. He said he's being punished for something he didn't do. It's frustrating. I didn't know the government could be so ignorant, he said. Among 3 raids in Southern Oregon, more than 170 patients were affected, including Beverly Ballard. I put my feet on the floor and I'm instantly in tears. This helped my pain so dramatically, she said. Ballard is in a wheelchair and says her pain is unbearable. She is protesting to help others who need the medication just as much as she does. It's very important to so many people, she said. A U.S. Department of Justice spokesperson said that the raids were not about whether sick people should be able to use marijuana for medicine. She says the issue is that the law has been exploited and people are selling drugs far beyond what was allowed by state law. The statement goes on to say medical marijuana is being found in large quantities out of state. However, protesters say they're following laws and are not giving up without a fight. So it's again, we have the government fighting, saying that it's saying one thing, and of course the reality is the other. The law enforcement keeps talking about how it's being sold out of state, as if it was only just started being sold out of state in 1998 when the Oregon medical marijuana law came into effect. Well, no. The fact is it's been transported out of the state for as long as anybody can remember, because Oregon is actually the capital, one of the main capitals, the pot growing capital, at least of the West Coast. So it's always been exported out of the state. So it's just another excuse, trying to tread on people's rights, and they continue. So, and then if that doesn't make you mad enough, now we come back and now the Oregon medical marijuana program raised their rates. Well, this is how these raids in Medford are going to affect patients. It says federal raids help Oregon raise $26,500 in medical marijuana fees. A series of federal raids on medical marijuana growers in Southern Oregon is forcing up to 175 medical marijuana patients to pay $150 each to the state in order to continue their doctor-recommended treatment. The total earnings for the state of Oregon from these patients could reach as much as $26,500. The windfall comes due to an administrative rule change that doubled the annual fee to $200 that patients must pay to register with the state medical marijuana program. New fees of $100 for a replacement card and $50 to register a new grow site were also added. And it is these new fees raised to put other state budgets in the black that have patient advocates seeing red. The feds come in here in the raids and take all the plants and medicine, but they also take all the patients' medical documents and cards, explains Lori Duckworth, Executive Director of Southern Oregon NORML, on the Accountable Affairs Program, A Different View. So now all of these patients have to pay $100 to get a replacement card and $50 to register a new grow site. While this would mean a net revenue of $26,500 for Oregon, A Different View host and medical marijuana clinic owner Eva Cunningham of Alternative Medical Choices Incorporated says that the $150 cost to many patients will be too high to renew. You've got sick and disabled people who have just paid $200 to $300 for their doctor's visits, another $100 to $200 getting their recommendation, and $200 to register with the state for a card that's 4 months late. Now we expect them to pay another $150 when they followed all the rules, jumped through all the hoops, obeyed state law, just because the feds didn't like it? Lots of patients will say, enough, screw it, I'm spending that money on the black market. The fee raise is a win-win situation for opponents of medical marijuana at the state and federal level, adds Jennifer Alexander, the campaign manager of the Oregon Cannabis Tax Act, which seeks to legalize and regulate non-medical marijuana use of marijuana. The state of Oregon raised the fees because law enforcement screams that there are too many patients and too much abuse of the program. They think raising the fees will reduce the number of patients. They've even figured it into the revenue projections. Now, with the federal raids, the state either gets more fee money with no increase in patient registrations or a decrease in patient registrations, which gives the state financial and political incentives to cooperate with the feds. So it's just when you think it can't get worse, and it just keeps getting worse. And that's one of the things that's disgusting about the fee increases is that the state hasn't seen fit to improve the medical marijuana program in any way that I can think of offhand. And they've certainly been asked to do a lot of things, which they have certainly refused, including adding some more conditions for medical marijuana patients. In other words, conditions that patients would be able to use medical marijuana legally for in the state of Oregon. PTSD is probably number one on the list. There's been 3 separate attempts to actually have it, formal attempts with testimony and paperwork and the whole bit, 3 different times, trying to add PTSD to the Oregon Medical Marijuana Program, but so far hit a stone wall and they won't even consider it. So they can care less about improving the program, but they're right there with their hand out to increase the fees and take the money from the program. And so now, as the story I just read, they're going to make even more money off the federal raids. Well, PTSD is something that we really need to be thinking about because we have a lot of our American soldiers coming back that are suffering from PTSD. And it says here, antidepressants and antipsychotic medications are among the most common ways to treat post-traumatic stress disorder and the insomnia, anger, nightmares, and anxiety that often come with it. Unfortunately, they're not guaranteed to be much help. That's what a study in August Journal of the American Medical Association suggested. Risperdal, a widely prescribed antipsychotic, is much more effective in treating PSD than placebos, they reported. This finding adds to an earlier research on the ineffectiveness of most PTSD medications. But there is a drug that has been shown to alleviate the symptoms of PTSD. Unfortunately, Veterans Affairs doctors won't recommend it, can't recommend it. And the federal government won't allow research to proceed that would prove its effectiveness. What's the drug? Marijuana. 16 states and the District of Columbia have medical marijuana laws on the books, but we are still a long way from general acceptance of the drug as a medicine. If we're serious about seeking an effective remedy for post-traumatic stress and serving the hundreds and thousands of veterans with the disorder, this needs to change. It's not a guaranteed solution, but sufficient evidence exists to show that it's a treatment that should be explored further. In 2006, one of the pioneers of medical marijuana in the United States, the late Todd McCura published a paper in a cannabis research journal reporting on his experience with PTSD sufferers. He compared marijuana to commonly prescribed medications and noted that the former worked better to control chronic stressors without adverse side effects. Based on both safety and efficacy, he wrote, cannabis should be considered first in the treatment of post-traumatic stress syndrome. A few years later, the Israeli physician Irit Akarov published a study in the Journal of Neuroscience that alluded to the potential benefits of marijuana for PTSD patients. He found in an animal study that cannabinoids, the active chemicals in marijuana, may reduce the effects of PTSD. The results of our research, he noted, should encourage psychiatric investigation into using cannabinoids in post-traumatic stress patients. In New Mexico, where PTSD was added as a qualifying condition to the state's medical marijuana program, after an evaluation of the available research, more patients use marijuana for PTSD than any other medication. So that's an interesting note, and by the way, that's true. And New Mexico is the only state that has the PTSD as a condition. So we're hoping that can spread. Veterans, if given the option to use marijuana to alleviate PTSD, would probably take advantage of the opportunity. In September, the military newspaper Stars and Stripes published a story about Army Sergeant James Raines, who talked openly about how he had used marijuana to treat PTSD triggered by heavy combat in Iraq. Marijuana was not just helpful, it was the only substance he found effective. So it goes on, and of course, they come back and say, well, it's anecdotal, which is, in my opinion, is kind of like saying, well, this could be all in your head. But the patients I've talked to, I wouldn't want to try to tell them that it was all in their head, so that they're living it, you know. So, and then medical marijuana, a case here in Arizona, and this is just one of those sad things. It says, as an Arizona nurse, I was fired for having a medical marijuana card. This is out of Cottonwood, Arizona. In what could be a first-of-its-kind case here in Arizona, a nurse is planning to file a wrongful termination lawsuit claiming she was fired for being a medical marijuana card holder. Her former employer said that's not exactly what happened. Esther Shapiro said she was fired 2 months ago after telling her bosses at the Verde Valley Community Hospital in Cottonwood that she held a medical marijuana card as a result of Arizona's recently passed and much debated medical marijuana law. Shapiro said that she had been working for a couple of weeks when she was asked to take what she called a pre-employment drug test. She told her supervisor she had a medical marijuana card. I said to her, I carry a medical marijuana ID, so it's going to come back positive, Shapiro recalled. She was visibly upset, and the whole point of carrying a medical marijuana card is that you're legal. It's nobody's business. Shapiro said she was fired the next day. According to Shapiro, the decision was made after the facility talked with its car insurance provider and was told that she would be too much of a liability. What's interesting about the fact is that we drive our own vehicles and carry our own car insurance, Shapiro said. It doesn't even make sense. Shapiro's lawyer says the law is on her side. The Arizona Medical Marijuana Act says an employer cannot discriminate or take an adverse employment action against an employee simply based on the fact that they are a medical marijuana card holder, explained David Weissman of Rose Law Group. Verde Valley Hospice was a slightly different version of the events. The owner, Bill Hayes, said Shapiro was not fired, but rather she abandoned her position. According to Hayes, Verde Valley was waiting to hear back from the state health department and their insurance company when Shapiro quit. Shapiro says she plans to file an unlawful termination suit in the next week or two. The issue of employer-employee relations is one of the several hot-button issues since the Arizona Medical Marijuana Act became law this year. So, anyway, it's again, the fight goes on. Discrimination. You know, you can take Oxycontin or any other drug you want to work and take it and be under the influence of it, but you can't be under the influence of medical marijuana. So it just makes your head so. And then another This is interesting. We had this report here a few weeks ago about the RAND report that reported that crime was actually down in Los Angeles, while they had a unique situation where they had a lot of dispensaries, and then the city made it shut the majority of them down. So they were up and then they were down, so they were able to check crime figures. And it turned out that police have always said that dispensaries increase crime in their neighborhoods. This study actually showed that it was decreased in the neighborhoods during that period. But anyway, now it says RAND retracts a study on neighborhood crime and pot clinics. The Santa Monica-based RAND Corporation today retracted a study which found the presence of medical marijuana dispensaries might reduce crime in their neighborhoods. A report that local law enforcement officials quickly dismissed. The study, Regulating Medical Marijuana Dispensaries, an overview with preliminary evidence of their impact on crime, was released September 21st. RAND had studied crime reports over the 10 days before and after June 7th, 2010, when the city of Los Angeles shuttered hundreds of pot shops. The think tank found that crime shot up 60% within 3 blocks of closed dispensaries as compared to those where dispensaries were allowed to remain open. However, questions raised about the findings prompted RAND to undertake an unusual post-publication internal review of the study. The review determined the crime data used in the analysis are insufficient to answer the questions targeted by the study. Specifically, RAND said the data described as covering the city of Los Angeles and surrounding areas did not actually include statistics reported by the Los Angeles Police Department. This was a rare failure of our peer review system, said Deborah Knopman, Vice President of the RAND Infrastructure, Safety, and Environment Division. We take our commitment to quality and objectivity seriously, so we have retracted the study in order to correct it. RAND researchers intend to conduct a new analysis once they have an adequate set of crime information, the organization said. So it'll be interesting to see how that one turns out, or if we ever hear from them again. And then this story here is really interesting to me because being the son of a gunsmith, I've been around guns all my life, and now as a medical marijuana advocate, the issues have come together. Gun rights and marijuana reform issues joined. The gun rights activists are generally perceived as coming from the political right, while marijuana reformers are typically thought of as belonging to the political left. Ironically, if they can get past their reflective distrust of each other, the two groups would discover that their pursuit of civil liberties is quite similar. The violence associated with the black markets caused by prohibition of marijuana provides political cover and motivation to those seeking to permanently curtail our Second Amendment rights in the name of law and order. Gun owners should understand that much of the impulse to overregulate and ban firearms would evaporate overnight, along with much of the crime, by joining forces with the anti-prohibition forces to take away the lucrative black market for both drugs and guns by legalizing marijuana. To begin with, left-wing activists should understand that the expansion of federal power to curtail their favored liberties, to keep and bear arms on one side, and to consume whatever substance consenting adult or their physicians desire on the other, began at roughly the same time. The Bureau of Alcohol, Tobacco, and Firearms was organized in response to the 1968 Gun Control Act. While its stated mission has been to support the nation's gun laws to prevent criminals and mentally incompetent people from acquiring firearms, the BATF has a history of what might be termed overzealousness. The completely avoidable damage in Waco, Texas, and the recent revelations that the ATF has been one of the primary suppliers of weapons to Mexican drug cartels via ill-conceived operations that have resulted in mayhem and death, e.g. Fast and Furious, are among many examples of the BATF's dysfunctional approach to law enforcement. The Second The second movement, enacted at the time that it illustrates the time of Americans as children in need of federal supervision, was the war on drugs announced by Richard Nixon in 1971. Whatever appropriate zest the BATF may be accused of pales in comparison to the victimization of our citizens by the war on drugs, which is really a war on drug users, aka Americans. The direct cost, $51 billion annually, to our court and prison system is well known. Less understood is the indirect cost in ruined lives, sundered families, and the pervasive violence that surrounds the drug trade as it does any highly profitable black market. Combating crime is a political cliche pandering politicians have evoked to control both guns and drugs for decades. But blaming either guns or drugs for violence is an intellectual cop-out. Neither per se cause violence. Competition for control of lucrative illegal markets for banned drugs makes violence an inevitable means to settle arguments, since neither the courts nor the police enforce business transactions between gangsters. While this ongoing violence fuels misguided outcries to add more gun prohibitions on top of gun prohibition, this secondary prohibition only creates another black market in guns, one that is exploited by the criminals themselves and leads to additional crimes, e.g. burglaries in search of firearms. So anyway, it's an interesting point to think about that they're both rights issues and a lot in common. I've been told years ago by a colleague that we should be doing more outreach to the churches, because he said the churches know what it's like to be persecuted, and they would have empathy for marijuana users because marijuana users are persecuted. So I don't know, maybe, but interesting thought. And then Bob Lee was the multimillionaire in California that financed the last legalization attempt. Well, now it's saying that the feds had targeted the leader of the marijuana legalization movement. Bob Lee has been targeted. As the federal government's crackdown on the state's medical marijuana industry expands, the Department of Justice has targeted Richard Lee, the leader of the movement to legalize pot in California. U.S. Attorney Melinda Haig sent a letter to the landlord of Lee's medical marijuana dispensary, Coffee Shop Blue Sky, ordering its eviction, according to people familiar with the situation. Lee, a soft-spoken libertarian who uses a wheelchair, is the founder of Oaksterdam University, which offers cultivation classes and business training for the cannabis industry. Last year, he poured $1.5 million into Proposition 19, the California legalization measure that voters rejected. The 4 U.S. attorneys from California announced a crackdown on the state's billion-dollar medical marijuana industry October 7th, charging that many dispensaries are simply fronts for the sale and distribution of illegal drugs. Since the announcement, federal agents have raided pot clubs and arrested growers. The actions highlight the conflict between federal and state authorities over medical marijuana, which is legal under state law but illegal under federal law. Medical marijuana advocates said Friday that targeting Lee seemed politically motivated because of his leading role in legalization efforts and the medical marijuana industry. It smacks of politics, said Dale Garinger of the medical advocacy organization California NORML. Haig declined to comment on the letter, but at the October 7th press conference, she said, "People are using the cover of medical marijuana to make extraordinary amounts of money. In short, to engage in drug trafficking." At the same time, Haig said her office had sent out dozens of letters to landlords and dispensaries in California's Northern District, ordering them shut down or face criminal prosecution and seizure of their property and profits. 3 dispensaries in San Diego and 1 in Marin received letters. She said that a letter had been sent to stores that sell marijuana and allow people to smoke marijuana near schools, parks, and other places where children learn and play. Coffee Shop's Blue Sky, located near Lee's Oaksterdam University, is also a block away from Envision Academy of Arts and Technology, a charter high school. So it's the battle goes on there in California, and it'd be him being a millionaire. That'd be kind of funny if he would turn around and just buy the building that the coffee shop is in and buy it himself. Anyway, the latest issue, Oregon Cannabis Connection, is out. You can pick it up at Cannabism. They're on West 11th, 401 West 11th. It has it there, and it's put out in Medford. It's got some great stories. It talks about the raids in Southern Oregon and a whole lot of things going on in cannabis related. So there was a story in here that I was looking at that I did want to talk about. And it's always fun to open the paper and see somebody you know in the paper. So, but let's see. Oh yeah, there it is. New York Police Department ordered to stop marijuana possession arrests. Well, this is kind of interesting. New York City may soon shed its infamous reputation as the pot bust capital of the world. Police Commissioner Ray Kelly issued an internal order on September 19th to the NYPD telling officers they can no longer arrest people for marijuana possession in public view if the marijuana, for marijuana in public view if the marijuana was not in public view before officers either searched the persons and produced it or the person produced it after an officer's demand that he empty his pockets. So apparently if it's in sight, they will cite you, but if they walk up, for instance, walk up to you and it's out of sight and then they find it in a subsequent search, then they won't cite you. So anyway, as they say, that although New York State has decriminalized possession of small amounts of marijuana, the NYPD has made a practice of stopping people, mainly young people of color, on the streets, searching them or demanding they enter the pockets, then charging them with possession in public view. Unlike simple pot possession, which is only a ticketable offense, possession in public view is an arrestable offense that typically lands a person 1 day in jail. So anyway, that's starting to back off somewhat in California, or I mean rather New York. So anyway, that's some news we have for tonight. I hope you come back next week. Remember, we have a special show coming up, the 420th episode. So if you want to be here November 21st at the studio at 4 p.m. for the celebration, come on by. But thank you, and this is Dank, and I'll be see you next time.